think we are ready to go. So, dear audience, again, welcome. I'm Mariangela Pellegrini. I work for the ERN-EuroBloodNet, so the European Reference Network on Rare Hematological Disease, and I'm very happy to welcome all of you to the second to last session of the topic on focus on von Willebrand disease for patients, organization, and healthcare professional. For introducing you this program, it is coordinated by the ERN and by the umbrella patients organization European Haemophilia Consortium that is represented by the von Willebrand Disease Committee and also patient representative, among who the ePAG, Baiba Ziemele. And this educational program is also created in partnership with EURORDIS-Rare Diseases Europe and supported by a scientific committee consisting with Professor Sophie Susen, Professor Jeroen Eikenboom, and Professor Flora Peyvandi. And I will now pass the floor to my colleague Daria, so she can introduce to you the scope of the program and the European Haemophilia Consortium. Thank you, Daria.
Thank you so much. Thank you, Mariangela. And as per usual, I would like to start with thanking the ERN-EuroBloodNet for cooperation and for creating a truly unique platform and project like this one. My name is Daria Camelia. I'm Education and Communication Manager at the European Haemophilia Consortium. EHC is an international non-profit organization representing 48 national patients organizations for people with rare bleeding disorders from 27 member states of the European Union and most member states of the Council of Europe. We represent approximately 120,000 people diagnosed with rare bleeding conditions such as hemophilia, von Willebrand disease, and other extremely rare bleeding disorders across Europe. Among those, von Willebrand disease is the most common bleeding disorder, affecting up to 1% of the general population. However, it is still very often neglected and overshadowed by hemophilia. So with this program, we aim to distinguish von Willebrand disease from hemophilia, and we focus on the particularities of this bleeding disorder. Within the framework of the program, we discuss very topical areas related to von Willebrand disease among patients and healthcare professionals, and we give visibility to the challenges of those living with this rare condition, including quality of life, access to treatment and care, medical services available in Europe, diagnosis, treatment options, and the overall patient journey through life. As Mariangela said, we have very few topics to go with. So today we have a very special webinar, and we focus on psychological aspects of living with von Willebrand disease. We will talk about emotional trauma. But before we go to the topic and the essence of it, I pass the floor back to Mariangela to tell more about the home rules and to introduce the speakers.
Thank you, Daria. So I start with the good news. So this program is accredited by the European Board of Accreditation in Hemophilia, or in hematology, sorry. Hemophilia is one of the fields in hematology, the EBA. And one session is one credit. How to do for getting the credit is really simple. You need just to participate to this program. You have registered with an inscription, so you have your tracking, and we will contact you at the end of the program, saying to you how many credits, so related to how many sessions you participate, you are entitled to get. The only things additionally to participation we request is to answer to a satisfaction survey that you will receive. It will really take like 3 minutes to answer. So please answer to it, because it's also a way for manifesting your interest in getting the credits. So some home rules. So your microphone is muted. It will be muted along all the presentation. You can write your comment, feedback, questions in the chat. They will be addressed at the end of the lecture. So we will have a Q&A in interactive. Of course, if you prefer to unmute yourself, this is possible at the end of the presentation. Just raise your hand and we will pass the floor to you. So finally, we arrived at today's lecture. As Daria said, we are going to talk about emotional trauma. This is really for us a very important topic because sometimes we underestimate the burdens that create emotional trauma when it comes to a disease like von Willebrand disease. So as usually, we have a duo or trio, so a mix among patient representative and healthcare professional. Today we will have 3 speakers with us. I'm happy to introduce the professionals one, the expert. So Lotte Haverman, that's a medical psychologist and associate professor at Amsterdam University Medical Center. And also we are glad to have with us Tessa van Gastel. I'm sorry if I mispronounce your name. That is a trained psychologist and PhD student at the Research Department of Child and Adolescent Psychiatry and Psychosocial Care in Emma Children's Hospital of the Academic Medical Center in Amsterdam. And Daria, do you want to introduce the patient representative?
With great pleasure. We have Jo Traunter with us today. She's UK Haemophilia Society trustee and EHC Willebrand Disease Committee co-chair. Jo, the floor is yours.
Thank you. So good afternoon, everybody, and thank you for joining us today for this webinar on von Willebrand disease and this emotional distress and trauma that some patients can actually experience as a result of their condition or living with their condition. As Daria said, my name is Jo and I am a patient with VWD type 2M. I'm additionally co-chair of EHC VWD and I'm a trustee of the UK Haemophilia Society. So I was invited today to share a parent-patient perspective. So I just was going to give you a little bit of a personal journey of my life with VWD, but highlighting those bits of my life which have particularly been challenging emotionally and psychologically, and that I know, and I've heard many times that many patients have suffered very similar who do suffer with this condition. So obviously it always starts at the beginning. And my story begins with, I suppose, that struggle for diagnosis. And for years, I experienced those unexplained bruising, bleeding, numerous investigations, but with very few answers, well, no answers. And my symptoms often were dismissed or they were misunderstood. And that made me feel ignored and maybe also made me feel that at times I was being labelled as dramatic or I was overreacting. But I knew, my parents knew that something wasn't okay. And I know that I was actually scared to take part in sports because I knew that I would end up covered in bruises and that I'd finish up having to hide my limbs for weeks afterwards because people would ask why I was covered in these bruises, to the extent that when I was a child, I broke my arm just playing with my cousins, and when the hospital saw the extent of bruises that I had, that I was immediately taken away from my parents, and they were questioned because they thought it was abuse. And as a family, that's really traumatic. And then as I got older and I had a period, regularly that was 2-3 weeks in duration. And I got to the point I was worried about leaving the house in case I had some breakthrough bleeding and I'd feel humiliated or embarrassed. My confidence was really knocked as a result of that. And I really struggled with anxiety and I avoided going to school and college, particularly sort of at the age of 15, 16. I just chose not to go. And as a result, that really impacted on my education and on my social well-being. So that sort of the lack of attention from medics and that constant gaslighting about my symptoms just added to my emotional distress. And I personally felt unheard and invalidated, and that compounded my suffering. And that really carried on until I was in my 30s. And then I had really a catastrophic bleed during childbirth. And that bleed nearly cost me my life. And that was really traumatic. But at least at that point, I was finally diagnosed with VWD, but it was rather a dramatic way to get a diagnosis and to get somebody to actually listen to me. So the delay in diagnosis that I experience really is very common with many VWD patients, and it really underscores that need for greater awareness and understanding of the condition. But now that diagnosis hasn't made me feel safe. I had been ignored and I had been dismissed by every clinician until I was in my 30s. And even now, I often encounter people who they know very little about my condition. And indeed, I feel like I know more than the clinicians who are treating me. I feel like more of the expert, and that doesn't make me feel confident if something did happen to me. So even after my diagnosis, that journey hasn't got easier. And that, I mean, I have to say that feeling of trauma, that feeling of not having good well-being isn't just about me. So my whole family had to be tested, and we discovered that my brother and my father also had VWD. Later, tragically, I lost both of them to big bleeds after their diagnosis. And this loss really has left me with a profound sense of guilt and anxiousness, because I constantly questioned if I could have done more to advocate for them. And I felt like I should have educated myself better, and that I could have somehow prevented what happened to them. And that guilt's a really heavy burden that I carry every day. So now, as a mother, I'm constantly fighting for my children's access to treatment and care. And I think I'm hypervigilant and constantly anxious about their well-being, especially when I'm not with them. So, and also I suffer from this guilt at passing on the condition and exposing my children to all of those anxieties that I've suffered. And that really I continue to struggle with now. And that's as strong as it was at the beginning, really. And it's not just me, it's affected my whole family psychologically. Even my middle daughter, who doesn't even have VWD, has been deeply affected by her family's experiences. And now she's developed a phobia of needles and bleeding. And the minute she sees any blood or anybody suggests that she has to blood test, she faints. And that's really as a result of witnessing what happened to me and that her siblings undergoing blood tests, etc. So this trauma has impacted her daily life as well. And she's not even, she doesn't even have the condition, but really that it's, what I'm trying to say is this is a whole family who are experiencing this emotional distress for our family's journey. So I think what I'm trying to say to you here is that living with VWD is not just about managing physical symptoms. It's about navigating a landscape of emotional and psychological challenges. Unlike haemophilia, von Willebrand disease doesn't have the same level of awareness or treatment options. And that leaves us feeling vulnerable and we don't feel safe. And the lack of reassurance and support just exacerbates our anxiety and fear. So I won't keep going on. So in sharing my story, I'm hoping that I'm able to shed some light on that emotional toll that VWD takes on patients and their families. We need better awareness. We need more effective treatments. More than anything, we need a healthcare system that listens and that can respond to our needs. And as a community, as a committee on the EHC, what we try to do is to, I suppose, raise our voices and share our experiences and and try and advocate for change and support each other on this journey. So I will hand you over now. Thank you so much for listening to my story, and I am going to hand you over to, I think it might be Lotte next.
I am going next. Yeah, and Lotte will go after me. I'm gonna share my screen. We just tested it, so it should work. Okay. Is it working?
Yes, perfect. Thank you.
Okay. Yeah, so first of all, thank you for inviting us for tonight for this webinar. And as said before, I'm a PhD student in Amsterdam UMC, and I would like to tell you something about my research projects, and then specifically about the focus group and interview study that I conducted. My research project focuses on the impact of a bleeding disorder on sexual functioning. Yeah, why did we do that? Because sexual functioning is an important aspect of quality of life. It strengthens relationships, identity, and self-worth. And in previous studies, we found that feeling restricted in sexual functioning is associated with lower levels of health-related quality of life. And why is that important for people with bleeding disorders? Well, they can be impacted or negatively impacted on their sexual functioning due to different difficulties. For example, in women, the heavy and prolonged menstruation can impact sexual functioning, but also possible bleeds after penetration can have impact on sexual functioning. And in men, the joint problems, muscle bleeds, pain, and also blood and semen can impact sexual functioning. And despite these possible difficulties in sexual functioning, this is not a topic that is often discussed with healthcare professionals. And we know that both the patient and the healthcare professionals experience difficulties in discussing the topic, for example, because they think it might be something that is private, or they think it's a taboo, or they experience a lack of time to discuss the topic, or they are unsure who is the right person to discuss the topic with. So therefore, we conducted the current study. And I know the study is about emotional impact of a bleeding disorder. So I will not only focus on sexual functioning, because we talk to women with bleeding disorders, and we know that women with bleeding disorders, but actually women overall, are underrepresented in research. So therefore, we took our chance. We thought we're talking to a lot of women, and we will not only ask them about the impact of their bleeding disorder on sexual functioning, but also on social functioning, work and education, and healthcare. And yeah, we'll show some quotes of the women with von Willebrand, what they shared during the focus groups and interviews. And already I recognized so many things of what Joe said before, of what the women said during these conversations. So first, or one of the first things all women reported was their feelings of insecurity and shame because of their heavy menstruation, but also because of bleeds and bruises. And this impacted their social functioning, but also impacted their work or education, and also in sexual functioning. One of the women, for example, said, even with both a large tampon and a menstrual pad, I still had a period leak, which left me feeling extremely insecure. So shows really the impact of the heavy menstruation. Furthermore, also the exclusion from social activities, often because of the heavy menstruation, which, as in the quote, led to iron deficiency, but also feeling unwell, which resulted in having to cancel plans with friends. And sometimes also activities had to be canceled due to being too risky for these women, possibly leading to bleeds. Another topic that was being discussed was the disclosure of the diagnosis to others, and also being different from peers. And this was actually something most women were quite clear about, that they do disclose their diagnosis because they know it is practical that others know what their diagnosis entails, more for like in cases of emergency, so others know what to do. So this woman of 40, for example, said, I understand the importance of disclosing my diagnosis, especially in case of potential emergencies. On the other hand, there were some women in the discussions who said, I do not disclose the diagnosis because I don't feel that impacted during daily life. And if I disclose the diagnosis, then my peers know I have something and I feel different. So there was a reason to not tell others they have von Willebrand disease. We also talked about support of a partner, of family, and of others. Most women felt quite supported by their partner and family, and others, for example, colleagues, especially when they understood the diagnosis, and especially in family, this is the case as they are familiar with the diagnosis or share the diagnosis. Some women also shared that if the other, for example, the partner, as in the first quote, is unfamiliar or doesn't understand the diagnosis, this can lead to worry or being too cautious. So this woman, for example, said, my partner might worry too that he was too rough on me, resulting in bruises, and that was specifically during sexual activity. And another woman said, and that was about a situation at work, I don't have to call in sick very often, but when I do, it is understood and accepted, which is a really nice experience, but it really differed between the participating women. Then specifically about healthcare, all women reported that they miss information about the impact of von Willebrand disease on their daily life. The quote here is about information regarding pregnancy or having a child wish. This woman said, we mostly were informed with percentages, but what we really wanted to know what those numbers meant. For us, it wasn't about effects, but more about how they affect things. So this is really in line with what is the emotional impact of having the diagnosis of von Willebrand disease. And that was something what other women highlighted as well, the impact of the diagnosis on mental health. And they also specifically mentioned information for women or girls reaching puberty, having their first menstruation, as it's a really insecure phase of life. And the von Willebrand disease can have a lot of impact in that phase of life. Next to the lack of information that was experienced was also the lack of knowledge, as Jo also told about in her talk before. Women reported that this could lead to feelings of fear and anxiety regarding medical procedures. This woman, for example, said, I become somewhat anxious when I'm at a referral hospital, uncertain about their understanding of my blood levels. I'm always alert to their actions. So they don't really have trust in what the healthcare professionals know. With the women that I spoke to, they said this was often the case in hospitals other than the hemophilia treatment centers. There the knowledge was better. And in line with the lack of knowledge, there was a downpayment of complaints and a delayed diagnosis. This woman, for example, said, the general practitioner did not investigate the cause of my nosebleeds and numerous bruises, which resulted in a delayed diagnosis and feeling really insecure about what's wrong, what are these complaints the result of. Then lastly, we talked about treatment, and this was mostly about the treatment of the heavy menstruation. And here you see both a positive quote and a bit more negative quote. So the first one is, thanks to the IUD, I do not longer experience heavy menstruation. On the other hand, the second quote is about that, actually other treatments than IUD are being missed. As this woman said, she wants to become pregnant, but she is hesitant to remove her IUD because then she will have the heavy menstruation again. So yeah, that's a difficult topic that was discussed during these focus groups. And men with von Willebrand's disease, they might also be impacted in their daily life due to the diagnosis. From literature, we know that they might experience a lower health-related quality of life, that acute bleedings can have negative impact on daily life. And again, the delayed diagnosis can result in a disease burden. During my study, we talked with men with bleeding disorders, specifically hemophilia, but we know that there is some overlap with von Willebrand's disease, so would like to show some quotes of what the men shared during the discussions. The first one is about a partner being too cautious regarding the diagnosis. So this man said, sometimes she gets nervous and takes the bleeding disorder, into account a bit too much. The second quote is about a bleed that happened during sexual activity. This is more about the partner reacting really well, actually, on this situation. This man told both my partner and I laughed at the situation. It was like a horror scene, but it really differed per person what the experience was. And also, when talking about this situation, most men said that they rather have a fun activity or sexual activity in this case, then prevent from bleeding and do nothing at all. So that was interesting to hear. And lastly, this one is more about dating and experiencing pain. This man said, going away for the weekend and strolling around the city isn't possible for me because I'll experience a lot of pain, and that's then the result of bleeds. Based on these findings of the focus group and interview study, but also based on findings of previous studies, we know it's really important to discuss complaints and worries with healthcare professionals, since it can maximize treatment benefits, also can help to diagnose early if the healthcare professional recognizes the symptoms, of course. Also, for example, in case of more psychological complaints or difficulties, multidisciplinary care is possible if that is discussed. And Lotte will tell a bit more about multidisciplinary care. And in case of difficult topics to discuss, so as in my study, the sexual functioning, but also stress and anxiety can be difficult to mention during consultations. The use of PROMs can be helpful. PROMs are patient-reported outcome measures, or in fact questionnaires, and they can help to screen for such difficulties and open up the discussion and then maximize treatment benefits, for example. So that was my part, and then I think Lotte will share her slides herself.
Is it working? Yeah.
Yes, thank you.
Well, thank you, Tessa, for all the beautiful citations from the women and men, but mainly thanks to Joe, because all the things I'm telling is more from a theoretical point of view. So I think I cannot do better, of course, but I think it's in line with what you told us. So my name is Lotte Haverman. I'm a medical psychologist indeed, and my research team is focusing on patient-reported outcome measures, developing psychological e-health interventions, and on medical trauma and EMDR. And with a special interest from my group in bleeding disorders. Tessa is one of the PhD students, and we have more research focusing on bleeding disorders, but also on other diseases. So sometimes my talk is also a little bit more general to tell you more about emotional trauma and illnesses. So why is it important to pay attention to the more psychological aspects of life? And this is something what's hard to understand for doctors, is that quality of life of a person is not influenced mainly by clinical outcomes measurable with CT or blood tests, but it is more often influenced by pain, fatigue, depression, or other kind of mental aspects. And to get more insight in how this influenced quality of life, we need to ask patients by talking to patients and to be alert on these factors, but for example, also by completing prompts. So the goal of a multidisciplinary team should be to prevent psychosocial problems, to prevent medical-related stress, and to support patients and family to lead an independent life with a high quality of life. That's why in the Amsterdam UMC we have, sorry, I have struggling to see my, so we have of course the doctor in the team for the physical exam and well the treatment plan. We have a physio to monitor the physical functioning, the joints, the rehabilitation after bleeds. We have a nurse, I think very important to detect psychosocial difficulties, to provide psychoeducation. It's important to have a social work, I think, for getting things organized around care and to know all the rules or options for additional care in specific countries. And we have a psychologist in the team to do the individual counseling and treatment for like more clinically or more heavy mental problems. This is something we presented in the last EHC meeting, and we used it the year before for the first time. This is an idea from the pediatric psychology, and it says that like most patients are sufficiently helped by providing information and psychosocial education. And this is around, like in a group of people with chronic illnesses, it's around 60-70%. And then there's a group of 30 to 40% who needs more immediate support and counseling. And on the top, you have around 10% of people who need clinical treatment, who are really suffering mental health problems related to the illness. And I think this is something that not everybody is aware of. And I think we are sometimes maybe happy we already provide this first step, number 3, but we really need to know who needs what kind of support and what phase of life. Well, the effect of bleeding disorders on we did a study on bleeding disorders in and quality of life in girls and boys. We found out that the boys between 0 and 18 years old reported not many problems compared to the girls, and especially the adolescent girl who has like problems or total quality of life scores, but also on school and psychosocial functioning. So I think we need to be alert for that group of patients with bleeding disorders. And we did the same for young adults, and that group we found that men were struggling with quality of life, physical, schoolwork, and psychosocial functioning compared to the girls. So they were not big groups, but it seems that we need to be alert from the age of adolescence to young adulthood in, I think, both groups, and to feel that then there are getting some problems that didn't seem to be there when they were younger, maybe because they were more safe, and the need to grow up as an independent adult is maybe challenging. And I think we also ask about we did a lot of interviews as well. And we found that there was an interesting report on the relationship with parents. It was very ambivalent. It was like that they were annoyed about parents being so careful and a little bit stressed about them growing up. On the other hand, they really needed them, for example, to get the medication, to be on time on the hospital visit. So it was an interesting, I think, a very clear struggle for the adolescents with bleeding disorders. Other themes that we discussed were the sports, not to be able to do all sports, but also to be on your own, traveling, going out, the self-infusion, the acceptance, and also education and work. And I think this is also something that we saw that a lot of the young adults decided to do something different that they maybe wanted to do or wish to do, just to be more careful and aware of their bleeding disorder. And another aspect that we didn't really were necessarily focusing on, but what got like a lot of attention was reproduction as a topic. So if we're talking about von Willebrand disease, I think you can imagine that there are stressful events. And I think Jo already mentioned in her life a few that are also mentioned here. So you can think of severe bleeding episodes, surgical procedures, misdiagnosed or delayed diagnosis, an emergency room visit, impact on the family, the caregivers, fear of complications. And I think this psychosocial impact or the stigma is something that can be very stressful. And that's something that's not like, maybe not everybody really realized, but stressful events are potentially traumatic. And if you look into the literature and you talk about medical traumatic stress, then you see that in the broad spectrum of traumatic stress, a severe illness or having a child or a family member, if you want to broaden it a little bit, is high in this top 10 of stressful events. So this is something that we really need to be aware of. What are traumatic stress reactions? That causes anxiety or constant worry. Flashbacks are a very important one. So that are intrusive memories which related to the experience, well, medical or maybe also something in the environment said or did, or the healthcare professional said, and it comes back like immediately and you feel like you're there again. And this is really something that we call intrusive. It's the avoidance, maybe not taking medication because it reminds you of a stressful event, or not want to go to the hospital. You can have sleep problems, a depression, or feeling like lack of any emotion. And you can also be overly alert and constantly, because you think that there are potential risks everywhere. A stressful event, the definition is that it's profound, that you feel a loss of control, that you feel powerless, and that it's unpredictable. And this is something that really gets into your body. The amygdala detects this danger and gives a signal to the hypothalamus, and then activates this fight, flight, or free response. And so this is a very biological circle, and the brain really reminds this. So if you, for example, walk in the what's called well, you go out for a walk and then you hear something in the bush, like you hear the plants or something, and then suddenly there's a lion. You didn't expect this lion to be there, but you're like full of fear, of course, and you fight, flight, or freeze. Well, the next time you walk again outside and you hear something, you hear like the trees again or something, it reminds your body reminds you of this anxiety. So it's not something you can suppress or you can really ignore. It happens. So in a situation where there is an event, a stressful event, it causes a high level of stress. This is totally normal. And then most of the time it goes down. If it doesn't go down, there are people who keep getting like on this high level. And then you talk about post-traumatic stress disorder. And it's important to realize that during this trauma, the stress levels are high. Acute reactions are normal to an abnormal situation. And then you have this long term. And there you have the distinction between a normal acute reaction and a prolonged high stress reaction, PTSD. And we know from the literature that there now also are patients where the stress level increases over time. So this is something we really need to be aware of, and in my opinion, need to screen for and pay attention to in a consultation room. Medical stress is often trauma which is accumulated because you have all these different events, which is what Joe also showed us. So your body don't get a chance to get back to a more relaxing phase, but gets like this circle over and over and over again, which makes it harder to get your stress levels down. So at some point you cannot recover, and the chance of getting PTSD is higher. Well, maybe in relation to the medical options for treatment, there are psychological treatments which are very effective for medical stress or emotional trauma. You have two, and I will highlight the EMDR. The cognitive behavioral therapy is also very effective, but it takes longer and it's more like a more intensive, longer treatment. But before we start with the treatment, what is the official diagnosis? It's that you've been exposed to trauma. So it can be direct, witnessed, indirect, and a repeated exposure. In my opinion, the PTSD diagnosis following the DSM, so the psychiatric handbook, is maybe not sufficient for medical stress because it always have to be life-threatening. Well, in a medical setting, it's not always like directly life-threatening, but it can feel like life-threatening. So I think this should be maybe, I always like adapt it a little bit in our setting, but you need to be exposed to a very stressful event. You have these intrusive symptoms, the flashbacks, nightmares, distress, re-experiencing, avoidance. You have some kind of an avoidance, could be in very different ways, can be avoidance of places, but also people. You have this negative mood or cognitions, guilt, also mentioned by Joe, is very important one, can be very hard to, or really can keep this stressed feeling and the PTSD alive. Hyperarousal, and it is still there after 1 month. And this is important because what I just told, this first period, it is normal to feel stressed after a very severe or traumatic event. Well, one of the most successful treatments, EMDR. I'm also trained as an EMDR therapist, and you go back to this traumatic memory and you really imagine what happened there, and you think about how this situation looks. You think about all the thoughts you had, the feelings, the sensations in your body, and then you have this distracting stimulus, which is the eye movement, for example. And the idea is that if you get a task and you need your working memory, you cannot feel the emotions as high as you did during the event. And then it's in some way, the emotional load of the memory gets vague. So the memory will still be there, but you don't feel this heavy emotions anymore. It's normally offered in 45 minutes a week, and well, when it's only limited to medical trauma, we see we can do a lot of healing in 45 minutes. It's very promising. I will show you a video. This is the excited part of my presentation. Also a little bit stressful for me to see if this works. Do you see this now?
Not yet, no.
No, I do. I choose another screen. I think that is better. 1 second.
When you start sharing, Lotte, you will see this option at the right of
Yeah.
including audio and video.
Yeah, I think
If you click it, yes, thank you.
I think it's working now. It's
Yes,
now.
we can see the video.
Try to make it full. Is it now on the full screen?
And have developed psychological symptoms such as flashbacks, fears, sadness or sleep problems, you may well be helped by EMDR, a proven and effective therapy. Suppose you have been confronted with a violent crime, an accident, you have been bitten by a dog, or you have had to deal with sexual abuse or violence at home. Such a powerful experience is stored into your brain with a lot of emotions. Once such a memory is stored in your long-term memory, it can bother you for quite a long time. The disturbing memory keeps coming back unintentionally, for example with feelings of powerlessness or believing you are not worthwhile. EMDR therapy can help you get rid of these complaints and feelings. At first, an EMDR therapist will ask you to activate the memory of this disturbing experience from your long-term memory. The memory is now stored in your short-term memory, also called the working memory. Then the EMDR therapist will ask you to focus on this horrible event. From there, the therapist will move his fingers in front of your eyes rapidly back and forth and ask you to track his fingers as best and as fast as you can. By keeping a traumatic memory in your mind and tracking the fingers of the therapist at the same time, the working memory gets to process a lot of information at the same time. As it is so much information, the image becomes blurred and loses its emotional charge. When the emotional charge of an image lessens, it also becomes easier to think differently about the experience. You will notice this because you feel less powerless or you feel worthwhile again. The intrusions have gone and you feel less anxious. You feel less depressed, you sleep better, and because you have managed to leave the experience behind you, you start enjoying life and looking forward to the future.
Well, this is of course created by the EMDR organization, so it's a little bit of a selling story, but it is the basis is correct, and I think it's very helpful. Well, this was my this was my last slide. Thank you for listening, and I think Tessa and I wanted to give you some take-home messages that we totally agree that there is a need for awareness of complaints and worries, and I think with our story we get you also again aware that well, I don't know if you can tell the centers you are being treated or visiting that this is something they need to pay attention to, and we will always tell this story. And that we as psychologists should be involved in multidisciplinary teams, that emotional trauma can be present in von Willebrand disease, and maybe more than a lot of patients realize, and that treatment for emotional trauma is possible. So, thank you.
Thank you, very much for the three of you for delivering those very important message in such a clear way. It has been very, very interesting. I want to stress one concept that wrote Daria in the chat. If you feel uncomfortable in raising questions because we can see your name and surname, you also can write privately to me or Daria. And we, of course, we will not tell who you are if you want to ask questions. I will read some comments that are wrote in the chat. So listening to this presentation, after a lifetime of diagnosis, I discover new things and identify new symptoms and emotions. Thank you. Thank you very much to the three of you. It has been a very important and interesting session. In my country, the psychosocial part, almost its totality, is carried out by the Patients Association, except in very specific cases in which a psychologist intervenes. After a long way and you get to the diagnosis, in many centers, they do not involve the psychological team. They only treat the clinical part, and obviously we are much more than our symptoms. My open question to the three of you. From your experience and your professional and patient profile, how can we work so that from the more clinical part, they understand that the emotional part is very important and give us tools and support? Thanks in advance. $1 million question for you.
Sorry, I missed if it was to one of us specifically?
The three of you.
Three
So,
of
well,
them.
of course, who wants, no obligation.
Yeah, I can start with my part. What I try to do to cover this is I think the doctors like scientific papers, so I try to publish on these topics as much as I can to highlight this. And yeah, in our team, we highlight this constantly by being part of the team. And a lot of my work is about psychoeducation to the team. We now have the case that doctors say, I have a patient I think that needs EMDR. And then I think, well, that's my job to indicate. But yeah, I think it's better than the other way around, not even thinking about this aspects. And how, yeah, well, maybe it's a question back, well, after Joe and Tessa, but I think it's a question back also to me or to you. What do you think what I can do to, I'm leading the psychosocial, well, now as an ex-chair, I have to be honest, but I set up and led the psychosocial committee of the EHED for almost 10 years. And I don't know, this is the platform where I try to acknowledge these kind of things.
I think as patients, what's really important is that we actually speak up and that we aren't just going in there and passively accepting that we have our checkup as normal and maybe they check our levels and they say, is everything okay? And you sit there and you say, yeah, everything's okay, rather than be truly honest about what you're feeling. Or if you're struggling, I think it's really important to say that you're struggling if you are struggling, because those clinicians, they themselves, they can't read minds. So if they don't know that this is a thing even, then it's very difficult for them to refer you. I think the more it becomes clear that there are people who are struggling, the more there will be access in things such as combined clinics to support people. But I think it does take a community that becomes much more vocal and advocate for themselves. And I think that's what we try to do as a committee, is to raise awareness in events such as this, where we bring people together to talk about it, so that we try and reduce some of that stigma, because I think when it comes to mental health, often there is a stigma around it and people feel a certain degree of embarrassment or shame, which they shouldn't feel. But I think only by speaking up, telling people how you feel, telling people why you feel like that, and asking if something can be done, will it start making people, centres, clinicians sit up and take notice. So from a patient's perspective, that's where I think what we need to be working.
And I don't really have anything to add. I think what Lotte said is also what I try to do, to publish work, but also at, for example, EADS, to present about what we found and highlights the importance of being aware of the impact on mental health. And I think I really hope that some clinicians pick up what we say and that they sort of spreads this to their colleagues and to raise awareness among the team. But it's a difficult, I think, this is something we all think about. Okay, how can we improve this? So
yeah, and I think in addition, so one of my research lines is focusing on the use of prompts in daily clinical care. So before a consultation, complete questionnaires which are relevant to the patient, including mental health questions, to have this information in front of the doctors or nurses, to always have this part, always have these topics part of a conversation. And I think also in bleeding disorders, the prompts are often seen as something that's only usable for studies or for quality registries or trials. But I think if you use it well, and it's part of the communication, it can be something to be sure that there is a structural attention for mental health, for example.
I think something else we can also do is, and I know that I'm always keen to put my hand up if there are any surveys or questionnaires or pieces of research which actually investigate the impact of VWD in mental health. And by participating in those kinds of surveys, again, it's raising awareness.
Daria, we cannot hear you. Maybe the input or output or the micro?
Can you hear me now?
Yes.
Okay, perfect. Sorry for that. Technical issues. I'm receiving some anonymous questions, so I will address them in random order. It's very sensitive, obviously. So I will start with the first one. Again, not in the order. So the person, and it's a girl, she says that when she was a child, she struggled a lot, but she never could tell why she felt that way. And she grew and she struggled more and more, and it grew into a trauma. She struggled first as a kid with the menstruation, and she did a lot to her mental health, of course, this. And then she felt also that the hospital didn't help a lot to her as a child. And then she started to use medication when she was 12, and she learned how to inject herself. And the issue is that the clinicians always stress the focus on how to inject, that it's important, to get injection, and no one really cared about the mental side of that. And they were only focusing how to find a vein and teaching this to kids. And whenever this person was telling to clinicians that she was struggling, every time she was just told that the medication is the most important thing. And none of them really cared about the mental health. And now this lady, she has panic attacks when she gets medication, and she has depression about the acceptance of disease. And basically, if you can give some tips or share something that could help her, of course, the question is mostly to Lotte and Tessa. Thank you so much.
Yeah, well, thank you for sharing this story. It is, this is an example, a good example how a traumatic events or accumulated traumatic events maybe can impact a whole life. This could be helped by getting EMDR, for example. You can Google on EMDR therapists in Europe. So there you can find somebody hopefully close to you. And yeah, you should really try to figure out with a therapist, or maybe cognitive behavioral therapy is an option too, but it sounds like she already tried some different therapies, so I cannot see, of course, what's done, but it sounds for me at this moment, of course, I'm not, that it's possibly related to these traumatic events early in life. And at some point your life is like avoiding and getting like physiologically a reaction to things that remind you of this early events.
She said that she is receiving help from a psychologist, but it doesn't seem working. She's also trying another therapist now, probably with different approach.
Yeah, I would definitely try EMDR.
Thank you. Tessa, I don't know if you want to add something.
No, I think Lotte is more the expert on the treatment here. So yeah.
Thank you. Thank you. Yeah, this person replied that she didn't try this approach, so she will definitely try. Thank you so much. Probably since I'm addressing anonymous questions, I will go to another one, and then Mariangela will, after that, give the floor to you. So I have another one, which is also anonymous. What to do when a sudden bleed happens during sex or after it, like bleeds or hematomas in private parts? It doesn't not happen because of violence, does it? Are there any strategies how to get over it, and also, of course, to explain to ourselves and also to partners and doctors afterwards what is happening?
I think that's a question for me. I talked about my research project with healthcare professional nurses and clinicians, and they really said if a bleed happens as a result of sexual activity, it's important to let them know, and they understand it might be difficult to share because it's something private that happens. But they want to know, and they can think along like, but should we do something different the next time when you engage in sexual activity? So yeah, I would discuss it with the clinician or the nurse, and then of course somebody you feel comfortable with also when discussing the bleeds. I hope that answers the question a bit.
Yeah,
Yeah.
Yeah, I think this question also sounds to me like that this medical team, maybe didn't really manage to get this person the feeling that she shouldn't be, or he shouldn't be ashamed of one of these things. And I think this is something with sexual activities. It's a big part of life of most and the far most people in the world. It's important to quality of life, it's important to self-esteem, it's important in relationships, and we still feel ashamed about having sexual activities. And as a psychologist discussing this team with medical teams, it's still, they point to each other. I think you discussed this, right? No, it's you. Oh, I thought it was you. So this is, I think this is what you hear back in this question. I think what Tessa also says and underscores is, please, if you have a bleeding, contact your center like you would do with other bleedings as well. And it's hopefully up to the team that a patient or a person, I prefer person, shouldn't be ashamed of having sexual activities. And there's a broad spectrum of sexual activities. And I think hopefully, and I think it is the case, that medical people from medical school are often not. I really think there's no necessity to be ashamed. I think they saw a lot, know a lot, and I think you have the possibility to discuss this.
Thank you so much. If Tessa, Joe, you don't want to comment or add, I will read a comment that we received on the chat. Is about experiencing that the healthcare providers ignore the mental health. So my doctor has never asked how I feel living with von Willebrand disease. A couple of years ago, I told her about the terrible menstrual bleed I had and that I was frightened of not knowing what to do and why it happened. So was on the floor crying for a few hours, but she never paid attention to the emotional part, just that my iron level is still okay, several months later. I would appreciate more compassion from doctors.
Unfortunately, many face this issue, and I see also other comments supporting this, that other people also experienced the same issues, that mental health is mostly ignored by healthcare providers. I have a question also to Tessa and Lotte coming, again anonymously. If there is any research that you're currently doing or planning to do on this topic, on mental burden in von Willebrand disease, and overall, what results you see the previous researchers also had on people? That's the question.
To do, I don't understand if we are doing more research now on this,
Yes,
on this
yes,
topic.
yes.
Yeah. No. Well, what we did was what I showed. So we had like focus groups, and we did some quantitative studies. And I think we shift to Tessa's project, who provide us a lot of information, I think, on and we had a high number of participants. So, but it was all in the Netherlands. So yeah, of course, if I hear all this, I always have my little book with me for new research ideas, and I think a huge research project in Europe on this topic should be very valuable, because I think it's still lacking not a lot of knowledge.
Thank you.
In the chat, there are no other topic. I don't know if you have other questions received
No,
privately.
nothing anonymous more. I'm a bit lost, to be honest, in all the comments, because there are some anonymous, some not anonymous.
Okay.
I'm a bit lost. I don't know if you read already the one addressed to Joe. Again, sorry, feeling a bit out of this because I'm chatting in parallel with people there. The one saying that, "Dear Joe, you're very brave." Was the thread already? No. Okay. I
No.
read it because it's very cheering at least a bit. Dear Jo, you're very brave, and I'm very sorry for all the experiences you had to live through, but I'm also glad that you have learned to use this pain and uncertainty to help other people through Europe and beyond, so others could access diagnosis and treatment sooner. We need more people like you. You're muted. You're muted, Jo. We cannot hear you.
Too much emotion, too much emotion.
I said I can see that is from Baiba.
It is.
And yeah, absolutely right back at Baiba. She is also a very brave and inspirational lady, and she's doing exactly what she's just commendedly doing. So, and yeah, we have to speak up, we have to ask, we have to be transparent about what we're going through, and then we have to advocate for ourselves and advocate for us any opportunity we get.
Thank you. So, waiting if another comment or question arrived, I can recall the next and last appointment. That will be the 20th of March. So we will talk about quality of life and how to improve it. So I hope you will all participate. Will be very sad, the last one.
I know. I also feel already sad about wrapping up the program, but I also feel very grateful to our speakers and to the audience for such an honest conversation today. And I myself was on the edge to start crying because, of course, it's a very sensitive topic. And thank you, everyone, indeed, for sharing and for being here and for being brave, for advocating, and of course to patients outside of EHC von Willebrand Disease Committee. If you ever have any questions or you feel alone, there is the whole community. Please reach out to the EHC. There are people to help you. And also to support you mentally, of course, because peer-to-peer support should not be overlooked. It is important as well. And please reach out to us. Our email is very simple, vwd@ehc.eu. The committee is there to support you.
So thank you very much. It has been really an important session, and advocating for mental health and also showing all the possibility we have of different kind of therapy, because we talk about the MDR, which is quite of cutting edge therapy. So there's not just the narrative one, the more classical we know. So we have other approach that can help in increasing mental health. So really thanks a lot to all of you, to the speakers for having dedicated their time and expertise with us and for us. So thank you very much. To the EHC for putting together this amazing program, and to all the participants, thanks also for sharing all your story and biography. Thank you very much. See you at the next session.
Thank you so much.
Bye-bye.
Bye.
Thank you.
Thank you.